So for the past couple of videos, 3 to be exact, I have been speaking about pricing. We talked about the different strategies in pricing, what you need to consider when you're pricing, and I also did some videos previously speaking about the mistakes you make when pricing and, just how to charge in general. But today I'm going to speak about, is this medical billing business thing just a side hustle, or can it replace your full-time job? Now, I got a question on one of my videos asking how many clients do you need to make $100,000 annually? Before that, I got a question saying something like, the only time they see medical billers doing a business on the side is like a side gig. It's not like a business where they can replace their full-time job. So I thought I would kind of like answer all of those questions all in one, since I have been talking about pricing all of this time. Now, if you've been here for any amount of time, you know me. I'm not going to like give you fluff. I'm going to tell you the real deal. And so there are many things that you need to consider when you are thinking about trying to make your business a $100,000 or a 6-figure business, because everybody wants a 6-figure business nowadays. You need to have some things in place. There are things that needs to be considered. And the first thing is your mindset. I'm sorry, it's your mindset. Because if you're not thinking in the way of trying to make it a 6-figure business, then you're not going to become a 6-figure business for the most part. You're going to be thinking of it like a side hustle, so you're going to be considering it a side hustle, and you're just going to be doing things as if it's a side hustle, especially if you have a 9-to-5 job or a full-time job. This is going to be like extra income, something that you just get that you can buy, extra things you want, or go on vacation, or do those little things that you want to do. So you have to first think about this like a business. And when you are in business, you do have financial goals. You need to figure out, how much you want to make for a particular year. That doesn't mean that you're going to make that, but you need to work towards making that specific amount. So your first thing is your mindset. You need to think about what you want for your business. Secondly, you need to think about the hours that you're working. How many hours do you want to work? Now, you are coming from, at least I am coming from, or I would consider most of us are coming from like an employee type of thing. So we have worked for somebody else, and now we're trying to do this medical billing business, maybe like a full-time, full income business, right? And so you want to think about the amount of hours that you want to work. For me personally, you all know, I've worked a full-time job, or I work a full-time job, and I have my medical billing business. So I didn't have as much time as someone who was just doing it full-time, right? And I have been thinking about, however, if I just want to quit my full-time job, or what goes on with that, what I would do, how many hours I would want to work. So if you are working this billing business completely by itself, you want to make this your full-time job, or your full income, then you would think about how many hours do you want to work. In a regular employee situation, we normally work 40 hours a week, which equals to 160 hours a month. Now, if you don't want to work that 160 hours a month, then you need to think about the amount of hours you want to work a month. When you have a business, you want to have some type of flexibility. You may not want to work as much as you work now. Again, this is how you're going to think differently when you are actually a business owner. You may want to work the 160 hours. You might not have any problem in working 40 hours a week. You just maybe don't want to work after work or something like that. And that's all fine. Again, this is your billing business, and you need to decide what you want to do. Everybody doesn't want to do what you want to do, but you need to decide what you want to do. Then the client size is going to be important, because there are small clients, or I would say small to medium clients and medium to large clients. Now, you can put them in any way that you want, but that's kind of the way I put them. It's either a small to medium client or a medium to large client. And so you need to figure out what types of clients you want to have. Do you want to have a big large client. Maybe this is a hospital, and of course with hospitals you have lots of providers. Or for me personally, I prefer smaller private practices that maybe have 1 to 3 providers in the practice. That for me is considered a small to medium practice. So a small practice for me would be 1 provider, and maybe like small to medium would be 3 providers. Again, that's going to be up to you. What type of providers or clients or practices do you want to target? But that is going to determine how fast you can get to that 100K annually a year. Then you want to think about the operations of your medical billing business. Who is going to actually be doing the billing? Are you going to be doing the billing alone, or are you going to maybe hire out a biller, or maybe you're going to be a biller and then you also hire out a biller? There are so many options, but as for me, I do the billing. I do the billing all by myself. And even in that way, I can still make $100,000 annually. So do you want to be solo? Do you not want to be solo? We all have different goals when it comes to our medical billing business. But this will also determine how fast or how slow you get to that 100K annually. Now, we keep always saying this 100K. This seems to be the number, or this 6-figure number seems to be the number that everybody wants to get to. And fine, I get it. But we have to understand that revenue versus profit is 2 different things. So revenue is what you bring in. And that's what we're going to talk about today. If you want to bring in 100K annually, that's what we're going to talk about. But I also wanted to talk about profit, because you want to think about your profit and not only your income or your revenue. Profit includes the revenue, but then it subtracts or it minuses your expenses. So all the expenses that you owe as a business owner, if that is, taxes, if that is insurance, office supplies, all of the things that you need to spend throughout the year, you have to factor that in as well. But I don't know what you are going to have as expenses. So what we're talking about today is just being able to make 100K a year in revenue. Then I want to throw in your minimum. So each of us has a different minimum. And minimum being how much is the least amount that you are going to accept for doing medical billing. We have all type of different providers who have a little bit of patients, a lot of patients. They want you to do one service or several services. There are different type of providers. So you need to kind of know what your minimum is. So maybe regardless of if a provider has 5 patients or, they have 20 claims or 500 claims, you want to have a minimum that you will accept for your services. Again, not every provider will be for you. And maybe you're not into taking new startup providers who are just starting out. And that is because maybe your minimum is too high for them. And that can be the issue, because if a provider is just starting out, they might not be able to afford your minimum, which could be $2,000, right? But you still need to know what your minimum is. And this doesn't include your add-ons. So you might have a minimum of $1,500, but if the provider wants you to do eligibility and verification, that's an add-on. If the provider wants you to do credentialing and contracting, that's an add-on. If the provider wants you to do patient statements, that's an add-on. So you may want to do it in that way, or you might want to combine all of that, and that is included in your minimum. But when you are trying to decide about how you're going to get to 100K, you need to keep in mind your minimum and not necessarily the add-ons, because some of your providers may not add these add-ons. So my example is going to be a medical biller who is not a new medical biller. So they are not just starting out, or they don't feel comfortable in charging a certain amount. They are maybe a more advanced, established medical biller. And they are either new with the specialty, or they are just focusing on one specialty, so that's kind of like their expertise. Or even if there's not a new specialty, they kind of feel comfortable in dealing with all specialties because they know how to use their resources or figure out what they need to do for each and every specialty, Okay, so that's the first thing. The second thing is going to be that their minimum is going to be $1,500. So none of the clients are going to pay less than $1,500. Also, they only want to work 30 hours a week. So instead of working 40 hours a week like how we usually work, they only want to work 30 hours a week, which is 120 hours a month. I did some calculations, and this is what you should also do if you're trying to figure out the math and trying to figure out how you can get to this point. So in my calculation, this medical biller could have 2 small providers and 2 medium to large providers. And let me show you how I got to that amount. So the minimum, which is $1,500, which is the least amount of money that this billing business would get, is for a small private practice with 1 provider, and they are a non-surgical specialty. Meaning it's, mental health, physical therapy, maybe chiropractic. That is their minimum for that. So that's the amount that we're going to try and calculate. But this person also does other specialties. And so they also do surgical specialties. And with that, the minimum is $2,500. So it would be a small private practice with 1 provider, but this provider actually does surgeries. So the minimum for that type of provider is $2,500. So in that case, that billing business would need 2 small providers, non-surgical, at $1,500, which would equal to $3,000 a month if they are charging flat rate. Now, I'm talking about this in flat rate because this is how I bill in flat rate. I don't do per hour, I don't do per claim, I don't do percentage. Now, as far as the add-ons, I might do that type of strategy as far as pricing, but I don't do that regularly. So regularly, I use a flat rate fee. So again, 2 small non-surgical practices would equal to $3,000. That is $75 per hour. Even though you're not billing per hour, you should kind of have an idea of how much hours you would work on this client's billing services. And for me, that is around 20 hours a month. So 20 hours a month, $1,500 is what I would charge a small private practice, non-surgical, 1 provider. Then if I got 2 additional medium to large size practices, then that would be $2,500. So $2,500, that would be around $83 an hour, and that would be 30 hours a month. So 2 small practices and 2 medium to large practices would equal up to $8,000. So $8,000 times 12 months would equal to $96,000. Now that would require me to get either another small practice or a medium to large practice. And if I get either one of those, then I would go over the $100,000 mark. So right now I'm at around 4 to 5 clients. So 4, if I get 2 medium and 2 small clients, would be $96,000. If I get 1 more over that, whether it's a small or a medium to large, then that will be over the $100,000 mark. So it just depends on what type of clients that I get. Now, when we're talking about what clients I get, again, I have to think about the hours that I am willing to spend on each client. As far as the small clients, I give about 20 hours a month to. That's $1,500, the base or the minimum level. That's 20 hours. If I do 20 times 2, that's 40 hours. Now, if I have 2 medium to large clients, that is 30 hours each. That's 30 times 2. That's 60 hours. So 60 plus 40, that's 100 hours. I still have 20 hours that I can give to another client, which would probably be a small client, and that would bring me over the $100,000 mark. Again, you might want to work these things differently. You might have 3 large clients where each one of them are 30 hours a week. That's 2,500 times 3. That's what? $7,500. You still have $500 that you can play with. You might have one small client with that. So it just depends on what type of clients that you get. You might want to only deal with medium to large clients or only deal with small clients. It all is up to you. But I just wanted to give you an idea of how you can reach that $100,000 mark. You have to know the mark that you're trying to reach, and you have to know your minimum of what you charge. If you don't charge flat rate, now things might be a little bit different. That's why I charge flat rate, because I think that it's an easier way for me to figure out how much I want to make, how fast I can get there, what I need to do to get there. But you might actually decide that you want to charge percentage, like how I spoke about in the other videos, or you might charge per claim. To me, those are not too predictable, and you kind of don't know how much you're going to make because it can vary at times. It can vary with hours if you charge per hour. It can vary with claims. If one month the provider only has 100 claims and the next month they have 200 claims, it's kind of hard to figure that out. That's why I have decided to go with flat rate. Now, if I do any additional services or anything like that, then I might decide to do percentage for outstanding AR, or hourly for eligibility and verification, which I don't do. But if I did decide to do, I might decide to charge that way. But I feel like with me having a minimum and me knowing what my flat rate is, then I can get to that $100,000 mark if I wanted to, and I can see how I can get there clearly. When you are doing it in other ways, when you have different pricing strategies, it's harder to figure out how you can get to that $100,000 mark. I hope that was helpful. Make sure you check out my other videos that talk about the pricing strategies, per claim, percentage, per hour, and flat rate. And I'll see you in my next video.